What's up, guys? Welcome back to the nursing channel. So today I'm going to answer the question, how many patients does a case manager handle on a daily basis? So how many patients does a case manager manage on a daily basis? Okay, and so to answer that question, I just really want to start off by saying it all really depends on which hospital you work at. For example, I used to work at a rural hospital out in the country, and it was like in Northern California, and it was a very small hospital. And so just to give you guys an idea of how small the hospital was, I had 20 med-surg beds, and it had 5 beds in the ICU, and then it had the ED with like about 8 beds, I want to say, and that was basically the entire hospital. So as a case manager at that small rural hospital, I managed about 25 patients. So the 20 in the med-surg and then 5 in the ICU. And so basically, I would have on just a normal day, I would have 25 patients, but it doesn't mean that I was managing all 25 patients at once each day. It just meant that I was only handling the patients that were discharging that day. And so out of those 25 patients that I had in my list, maybe only 5 patients were discharging that day. Maybe 3 had to go to a skilled nursing facility, and the other 2 patients were going home and maybe just needed home health, and the other patient needed oxygen equipment. So just because you have 25 patients that day doesn't mean that you're working on each patient. It just means that, you just got to look at the number of patients that are discharging that day. One more thing is that sometimes you'll have 10 patients to manage on a day, and 5 of them are discharging, or sometimes you may have on another day you may have 10 patients that are discharging, and five of those patients may not have any discharge needs, meaning you don't have to do anything with them because the patients are independent, they're ambulatory, they have family support at home, and they don't need any home health services, and they have all the equipment that they need at home. So the other 5 may have discharge needs, and those are the 5 patients that you need to work on. And so each day the number of patients that you're working on varies. Sometimes you only have 3 patients that are discharging, and you'll find that you may have a lot of downtime, and so with all that downtime that you have, you should use that time to work on your other patients that may be discharging tomorrow, or in 2 days, or in 3 days. That way you could kind of start wrapping up those patients, and when that day comes when they're discharging, you won't have to scramble and start working on them last minute. So that's how you want to manage your time as a case manager. And then just to give you another example, when I stopped working at that small rural hospital, I worked at a much larger hospital. It was a hospital with 650 beds, which is actually the hospital that I'm still working at right now. And this hospital has different services. It has pediatrics, it has specialty units, cardiac units, it has renal, it has acute care surgery, it has a burn unit, it has a trauma unit. So this hospital has different floors, and so the number of patients that you have as a case manager, they're dispersed. The number of patients you have depends on how many services you have. For example, at this hospital, each case manager has about 2 or 3 services. So I may be managing like the acute care surgery unit that may have like 10 or 15 patients. I may be handling the gynecology service that may have like 5 or 7 patients, or I may be handling the burn unit, which may have like 15 patients. But like I said, just because you have that number of patients doesn't mean that you're working on every single patient. You're only working on the patients that are discharging that day. And if you have free time, start working on the patients that are going to be discharging tomorrow or in 2 days. That way you start wrapping up these patients. Okay? So each day varies as a case manager. Some days are busy, some days can be chill with little to do, and some days are just, are a mixture of both, where it could be busy in the morning and then it could be slower at the end of your shift. So with that being said, so that's my answer for you guys on how many patient cases we manage on a daily basis. And just wait for me right there for a second. All right, guys, sorry about that. Just wanted to make sure I looked at my notes to make sure I covered all the questions that you guys had for me with regards to how many patients we manage on a day-to-day basis. All right, guys, if you guys have any other questions for me on the case management topic, feel free to comment below. Don't forget to like this video and subscribe to this channel. I've been getting a lot of comments from you guys, and the next video that I'm going to make for you guys is how to interview for a case management position with no case management experience. So I'm looking forward to making that video because a lot of you guys have requested it, and I will be working on it soon. All right, guys, have a great day. See you guys later.